A study in the Journal of Women's Health revealed that 40% of postmenopausal women still feel guilty about self-pleasure, and almost 1 in 3 quietly endure discomfort. Too many believe it's normal, something they must accept with age. But that belief is not only wrong, it's harmful. The truth is, the problem isn't your age, it's how you're doing it. I'm Dr. Eliza Hart, a board-certified gynecologist with over 15 years of experience helping women navigate menopause and life after 50. In my practice, I've seen thousands of women struggle silently with changes in their bodies, often believing they had to give up intimacy altogether. My mission is to provide honest, medically accurate guidance so you can feel confident, safe, and empowered at every stage of life. Here's the reality: what worked for your body in your 30s or 40s may actually cause harm after menopause. Hormones shift, circulation slows, and tissues become more delicate. If you ignore those changes, self-pleasure can quickly turn from healing to harmful. But if you adapt, it can be one of the most powerful tools to protect your hormones, support blood flow, and even improve your emotional well-being. That's why in today's video, I'll reveal the 5 most common medical mistakes women over 50 make when it comes to self-pleasure and how to avoid them safely. By the end, you'll know exactly how to transform this private habit into a practice that supports your health and helps you reconnect with your body. And before we dive in, don't forget to subscribe for more women's health advice designed specifically for life after 40. 1. Mistake number 1. Rushing through self-pleasure. One of the most frequent patterns I notice in women over 50 is not dramatic or obvious, yet it quietly undermines health over time. It is the tendency to rush through self-pleasure as though it were a quick duty to complete before bed. Many women confess they do this unconsciously, either because they feel pressed for time or because they were raised to believe that sexual needs should be hidden, minimized, or dealt with quickly. Treating an act of care as a chore prevents the body from receiving the restoration it is designed to provide. From a clinical perspective, this has real consequences. Sexual arousal is not just about touch. It is about the body's shift from tension to relaxation, from restricted circulation to open blood flow. If you allow yourself only 2 or 3 minutes, the nervous system remains in a semi-stressed state. Blood vessels in the pelvic region do not dilate fully, which means oxygen-rich blood fails to reach the vaginal and vulvar tissues as it should. After menopause, estrogen levels fall, and these tissues depend on every bit of circulation available. Without it, dryness worsens, sensitivity declines, and irritation becomes more common. Ironically, women who rush often do so to avoid discomfort, yet rushing is what makes discomfort more likely. By cutting short the natural process, the body is left unprepared and pain replaces pleasure. Medical data confirms this. A 2019 study in the Journal of Sexual Medicine showed that women over 60 typically require 10 to 15 minutes of gentle arousal to reach the same vascular response younger women achieve more quickly. In other words, time is not indulgence, it is a physiological necessity. Without this window, the body misses the lubrication and vascular support essential for safe, satisfying intimacy. Consider one patient I once treated, Carol, a retired teacher in her mid-60s. She admitted that she often hurried, believing age made comfort impossible anyway. She assumed that pain was simply her new normal. When I encouraged her to devote at least 15 minutes, beginning with calm breathing and relaxation, before any touch, the difference was striking. Within weeks, she reported less dryness, less pain, and the return of sensations she thought were permanently gone. Her hormones had not changed, but the time she gave herself had. The adjustment required is not complex, but it does require intention. Reframe self-pleasure as genuine self-care, not something to sneak in quickly. Before beginning silence distractions, breathe deeply and allow yourself to arrive fully in the moment. This is not about racing toward orgasm. It is about preparing your nervous system and blood vessels so that every other step becomes easier and more rewarding. Women who learn to slow down often discover that what once felt like obligation transforms into something nourishing and restorative. They find their bodies are still capable of responding, and that realization changes everything. More importantly, this shift prepares the ground for addressing the other mistakes many women make. Because once you give yourself time, you start noticing patterns you may have overlooked, and that awareness opens the door to deeper healing in the chapters ahead. 2. Mistake number 2. Using too much pressure. Another frequent mistake I see is the habit of applying too much pressure. Many women develop this pattern gradually, often without realizing it. As sensitivity declines with age, the instinct is to press harder, grip tighter, or move more aggressively, hoping to recreate the intensity once felt in their 30s or 40s. What begins as a small adjustment can easily turn into a habit that backfires, leaving the body less responsive, not more. From a biological perspective, the explanation is straightforward. Nerve endings in the vulva and clitoral tissue naturally diminish in sensitivity after menopause. Estrogen loss also causes the surrounding connective tissue to become thinner and less elastic. Strong, repetitive pressure compresses fragile blood vessels, restricts circulation, and can even cause microtears. Instead of enhancing sensation, it slowly conditions the nervous system to respond only to intense stimulation. Over time, this narrows the range of touch that feels pleasurable and makes gentler forms of intimacy difficult to enjoy. The long-term consequences can extend beyond solo experiences. Some women tell me they can only feel aroused with a very firm grip, but when a partner touches them more softly, they feel almost nothing. This phenomenon, sometimes referred to informally as death grip, is not a reflection of aging hormones alone, but of the body being trained to expect one narrow type of stimulus. Research underscores this reality. A 2020 review in the American Journal of Obstetrics and Gynecology reported that nearly 30% of women over 60 experience diminished response due to chronic high-pressure habits. Importantly, the study emphasized that this desensitization is often reversible with consistent retraining and healthier stimulation methods. Let me illustrate with a case. Susan, a woman in her early 70s, confided that she could no longer enjoy intimacy with her husband. Over the years, she had relied on strong, direct pressure during self-pleasure, believing it was the only way she could reach climax. Eventually, nothing else felt satisfying. With guidance, she began to ease back on the intensity, introducing lighter strokes, combined with a high-quality, water-based lubricant. At first, she found the change unsatisfying, but within a few months, she reported improved sensitivity and the ability to respond positively to her partner's gentler touch. The corrective steps are practical. Begin by consciously reducing the amount of force you use. If you normally apply strong pressure, shift gradually to lighter contact. Combine this with generous use of lubricant to minimize friction and allow tissues to remain hydrated. Patience is essential. The nervous system needs time to reawaken and recondition itself. Think of this as physical therapy for intimate health. The goal is not to eliminate sensation, but to expand it, helping your body respond to a wider range of stimulation once again. Women who succeed in softening their approach often describe a renewed sense of possibility. They rediscover subtler sensations, feel less dependent on forceful techniques, and experience a deeper connection to their bodies. Most importantly, this shift helps protect delicate tissues from unnecessary injury and ensures long-term comfort. And once women understand how pressure affects sensitivity, they are often more open to addressing another overlooked factor, one that can determine whether the entire experience feels nourishing or painful. 3. Mistake number 3, ignoring lubrication. Among all the issues I address in postmenopausal care, ignoring lubrication remains one of the most common and preventable mistakes. Many women believe dryness is an unavoidable part of aging, something they must quietly tolerate. As a result, they either avoid self-pleasure altogether or continue without support, assuming pain is simply part of the process. This mindset not only reduces enjoyment, but actively increases the risk of irritation and long-term discomfort. Medically, the explanation is clear. After menopause, estrogen levels fall significantly. This hormone decline causes the vaginal lining to thin, reduces natural moisture, and makes tissues more fragile. Without adequate lubrication, friction during self-pleasure can create micro-tears, soreness, or even infections. Beyond the physical impact, the brain begins to associate intimacy with pain, reinforcing avoidance and deepening feelings of loss. What could have been an opportunity for comfort becomes a source of stress and disappointment. The statistics are sobering. The Mayo Clinic reports that nearly 45% of postmenopausal women experience persistent dryness, yet fewer than half seek any form of treatment or support. This means millions of women silently struggle with a problem that has a simple, accessible solution. Ignoring lubrication does not only limit pleasure, it undermines vaginal health, increases the likelihood of urinary tract infections, and accelerates atrophic changes that further weaken tissue over time. A patient of mine, Linda, age 67, shared her experience. For years, she avoided touching herself because every attempt brought burning and soreness. She assumed her body was telling her to stop, that intimacy was no longer meant for her. When I explained that a high-quality water-based lubricant could change everything, she looked doubtful, but agreed to try. 1 month later, she returned with tears in her eyes, telling me she had felt genuine pleasure for the first time in years without pain. What restored her confidence was not a complicated medical intervention, but the right form of support at the right moment. The correction here is straightforward: use lubricant every single time. Choose products that are unscented, free of glycerin, and specifically designed for sensitive tissues. Water-based lubricants are easy to clean, while silicone-based options provide longer-lasting hydration if dryness is severe. And do not be afraid to use more than a drop or two. Applying generously ensures tissues remain protected and comfortable throughout the experience. This is not a sign of weakness. It is a sign of wisdom, a decision to support your body with what it needs now, not what it needed 20 years ago. If you have ever felt discouraged by dryness or pain, please know you are not alone. Countless women share the same struggle, and many have found relief with something as simple as consistent lubrication. In fact, I would love to hear from you if you've ever faced this challenge. Type 1 in the comments. If dryness has not been your concern, type 0. Your feedback helps me understand what matters most and allows me to create content that truly supports your health. By giving your body the moisture it requires, you create the conditions for healing rather than harm. And once lubrication is no longer neglected, another dimension becomes clear: the role of emotions. Because even when tissues are well supported, unresolved feelings can quietly disrupt pleasure just as much as physical dryness. Mistake number 4, ignoring emotional factors. When most women think about sexual health after menopause, their attention goes straight to hormones, dryness, or circulation. What often gets overlooked is the impact of the mind. Emotional patterns carried for decades can shape how the body responds far more than many expect. In my practice, I frequently meet women who have no major physical barriers, but still describe their experiences as strained, incomplete, or even guilt-ridden. The missing piece is not always lubrication or technique. It is the emotional weight they have never addressed. Physiology and psychology are inseparable. Stress, guilt, and unresolved grief activate the sympathetic nervous system, which keeps the body in a guarded state. Pelvic floor muscles tighten, breathing becomes shallow, and circulation slows. The result is a body that cannot fully relax into pleasure even when physical conditions are ideal. Elevated cortisol levels produced by chronic stress further disrupt sexual function by interfering with the release of oxytocin and dopamine, two key chemicals that support arousal and satisfaction. Clinical data reinforces this. A 2021 survey published in the Journal of Women's Health reported that 40% of postmenopausal women continued to feel shame or guilt around self-pleasure, often linked to beliefs formed in early life. Those women were significantly more likely to experience pain and dissatisfaction than women who did not carry the same emotional burden. This is not coincidence. It is biology. The brain's interpretation of an experience influences the body's capacity to respond. One patient I recall vividly was Mariah, age 61. She confessed that each time she touched herself, she immediately heard her mother's voice warning her that such behavior was wrong. Even after decades, this voice haunted her. As a result, her body never relaxed. Her breathing stayed shallow and her pelvic muscles tensed involuntarily. Through counseling and gentle reframing, she slowly replaced those inner messages with kinder ones. With time, she began to notice genuine comfort, finally free from the tension that had shadowed her intimacy for years. Addressing emotional barriers requires compassion, not criticism. Start by noticing the thoughts that arise when you give yourself attention. If guilt surfaces, acknowledge it without judgment and remind yourself that caring for your body is a form of health maintenance, not an act of shame. Simple techniques such as mindfulness breathing, journaling, or guided relaxation can calm the nervous system and create space for safety. For women with deep-seated beliefs, professional counseling can provide invaluable support. What I emphasize to my patients is that emotions are not secondary. They are central. Without emotional safety, the body resists. With emotional acceptance, the body softens. Blood flow improves and sensation returns. This does not mean every doubt or fear vanishes overnight, but small steps toward kindness can make measurable differences in both comfort and satisfaction. If this resonates with you, I encourage you to share your experience in the comments. Whether you've struggled with guilt, sadness, or the feeling of invisibility, know that your voice matters and that other women benefit from hearing they are not alone. And once emotions are recognized as part of the healing process, the final piece of the puzzle becomes clear, listening carefully to the body's warning signs before they develop into more serious conditions. 5. Mistake number 5. Not listening to warning signs. One of the most concerning patterns I see in older patients is their tendency to dismiss discomfort as nothing more than normal aging. They notice burning swelling or unusual discharge, yet instead of seeking help, they quietly endure it. This silence can allow small, treatable problems to grow into significant health risks. Ignoring your body's signals is not resilience. It is neglect, and it can compromise both comfort and long-term health. Physiologically, pain and irritation are messages from the nervous and immune systems. After menopause, tissues are thinner and more fragile, making them especially sensitive to micro-tears infections and inflammation. When women ignore these signs, small injuries can progress to chronic conditions such as vaginal atrophy, recurrent urinary tract infections, or pelvic floor dysfunction. What seems like a minor nuisance may actually indicate that the body is struggling to maintain balance. The data supports this concern. According to the Cleveland Clinic, nearly 1/3 of postmenopausal women develop symptoms of vaginal atrophy, yet many delay seeking treatment for months or even years. This delay not only prolongs discomfort but also increases the likelihood of complications that require more intensive intervention later. I recall the case of Nancy, a 69-year-old woman who endured persistent burning during self-pleasure for over 6 months. She assumed it was simply the price of getting older and never mentioned it to anyone. By the time she came to see me, she had significant inflammation and early signs of atrophy that could have been addressed more easily had she spoken up earlier. With targeted therapy, including localized estrogen and consistent use of lubricant, she eventually improved, but her recovery was longer and more challenging than it needed to be. Her story illustrates the cost of ignoring early warnings. What should women do instead? First, pay attention to your body. Pain dryness that does not resolve with lubrication swelling or any unusual discharge should never be dismissed. These symptoms are signals that deserve respect, not silence. Second, seek medical evaluation promptly, even when the issue turns out to be minor. Confirming that with a professional provides reassurance and prevents escalation. Third, remember that speaking up is not a sign of weakness. It is an act of responsibility and self-care. In my consultations, I often tell patients that their bodies are not betraying them, but protecting them. Discomfort is the body's language for alerting you to problems before they worsen. By listening and responding early, you not only preserve your intimate health, but also safeguard your overall well-being. If you've ever hesitated to bring up these symptoms with your doctor, let me encourage you, your concerns are valid. And if this discussion resonates, share your thoughts in the comments. I want to know how many of you have ever felt uncertain about whether to seek help. By learning to respect your body's warnings, you close the gap between neglect and care. And with this final correction, we can now step back and see the bigger picture, how avoiding these 5 mistakes together transforms self-pleasure from a source of frustration into a practice of healing and vitality. As we reach the close of this conversation, let's step back and look at the bigger picture. We've examined the 5 most common mistakes women over 50 make when it comes to self-pleasure, rushing through the process using too much pressure, ignoring lubrication, overlooking emotions, and dismissing warning signs. None of these mistakes mean you are broken or beyond repair. They are simply habits shaped by years of silence, misinformation, and the natural changes of aging. What matters is not the past, but the choices you make now. The truth is that your body after menopause is not failing you. It is inviting you to care for it differently. Hormone shifts, changes in circulation, and emotional weight are real, but they are not barriers you cannot overcome. By slowing down, softening your touch, supporting yourself with proper lubrication, tending to your emotions, and respecting warning signs, you create a new foundation for health. This foundation not only reduces discomfort, but also restores confidence, preserves intimacy, and enhances your overall sense of vitality. My advice to every woman listening is this: approach self-pleasure as a form of preventive health care. Just as you would nourish your body with balanced meals or protect your heart with regular exercise, you can safeguard your pelvic health and emotional well-being by treating intimacy with yourself as worthy of care. Begin with small steps. Set aside unhurried time. Choose the right products. Breathe through moments of guilt or doubt. And most importantly, listen when your body speaks. Every signal is valuable. Every sensation is meaningful. What I have seen in decades of practice is that women who honor these principles do not just regain comfort, they regain a deeper connection with themselves. They feel more alive, more balanced, and more open to intimacy with others if they choose it. Age does not take this away. Neglect does. And when you replace neglect with care, healing begins. If this message resonates with you, I encourage you to subscribe so you never miss future discussions designed specifically for women navigating life after 40. And if you've ever faced one of the challenges we discussed today, type 1 in the comments. If not, type 0. Your feedback helps me continue to create content that truly supports you. Thank you for giving me your time and trust today. Remember, you are not too late, and this is exactly where your journey begins.